Following this story closely this morning, police just telling me moments ago the driver facing DUI charges, Jeffrey Conkey, is still being held at St. John's Hospital. Not all school buses come equipped with seat belts. You can see here a safety hazard, but that could soon change. We're getting a better look at the scene right here. This car came smashing into this gun shop right in front, nothing but glass and brick. Yeah, we're looking at major storm damage in Washington Park this morning. You can see all this damage behind me. We're looking at tree branches, tree limbs. Well, this morning, police say they're still searching for the driver that hit that 22-year-old woman as she jogged right here. So this is truly a once-in-a-lifetime opportunity. There are at least 200 to 300 Cubs fans lined up and around the ALPLM.
Akilah Davis is live at the YMCA with the team. Akilah, good morning.
So here's how it would work. The device takes off in the air, hovering over the fields, looking for problem areas. It's a story you'll only see tonight on News Channel 20 at 10. One local hospital seeing a surge in patients that can't stop using the drug, not even while pregnant. In emergency situations.
High-risk narcotic search warrants. We do barricaded subjects, hostage rescue.
The Springfield SWAT team is called out, using their tactical skills to monitor and gain control of high-risk situations. But in order to wear the vest, you've got to first pass the test.
The testing is a physical agility test combined with a shooting test.
It's a series of obstacles and exercises, testing their ability to complete the tasks in a timely manner.
Running, push-ups, sit-ups, obstacle course, and we follow that up with a shooting qualification course.
Lieutenant Chris Mueller says it's tough, but if you can't keep up physically, you become a liability to the team.
Dig deep. Get it up and run.
And that's why physical fitness is crucial.
For me personally, it's more mentally challenging than physically challenging.
This is Brian Riebling's third attempt at trying out for the Springfield SWAT. He's been a patrol officer for 3 years and says he's been training for this day for a while.
It's the culmination of all the events put together, which is what makes it difficult. So when you combine the run with the physical portion as far as the push-ups and the sit-ups.
Lieutenant Mueller says so far this year, the SWAT team was called out about 30 times, mostly for narcotic search warrants.
All the way through. All the way through.
And that's why Mueller says being fully staffed and having tryouts like this give the SWAT team the manpower it needs to keep Springfield and surrounding communities safe.
We want to make sure that if there's an incident in the city or in the region that we serve, that we have the members, we have the bodies to address the situation.
And now for a special report. Babies addicted to opioid drugs. They're the new victims in the opioid epidemic spreading across the country. Tonight in a special report, News Channel 20's Akilah Davis shows us how doctors are battling this devastating trend.
Well, hi, good evening. Recovering heroin addicts suffer from horrific side effects, everything from a fever, insomnia, and even vomiting. And now local hospitals are seeing these very symptoms in the youngest, most fragile patients.
Before you knew it, I needed it to function.
It's a trip down a dark memory lane for this woman as she reflects on what used to be her everything, heroin.
Couldn't take care of myself or anybody else without having it, or I'd be sick. And so it very quickly becomes an addiction.
A $100 a day addiction lasting 1 year. She was prescribed methadone, which is also an opioid like heroin, to suppress her cravings.
When I take it, within probably 10 minutes, you feel better.
But when she found out she was pregnant 9 months ago, that pill that's kept her sober would have drastic side effects for her unborn child. Today, just weeks after giving birth, her daughter is still a patient in the hospital, recovering in the St. John's NICU, being treated for neonatal abstinence syndrome, a medical term for babies born addicted to drugs their mother took while pregnant.
So we are seeing a number of infants now born who are addicted to opiate medications or drugs like heroin.
Neonatologist Dr. Ginger Darling says St. John's Hospital's neonatal intensive care unit is seeing a significant increase in babies born addicted to opioids.
We used to see one baby every month, every other month. And now we have, anywhere from 2 to 3 a month, if not more.
She says last year, close to 40 babies were born addicted to some sort of substance. A tough job for staff in the NICU, administering 24-hour care to newborns.
Depending on the type of medication or drug they've been exposed to, typically anywhere from 24 hours of age to 2 or 3 days of age, the babies start to become symptomatic.
NICU staff wean the babies off the drug, a process that's not easy to watch, especially since they experience some of the same withdrawal symptoms as adults.
They're very irritable, very hard to console. They have trouble sleeping, jittery. They shake a lot is what people would say. They have problems with GI upset, so vomiting, diarrhea.
She says babies exposed to heroin in the womb could even experience seizures during the recovery process. On average, babies withdrawing have an extended hospital stay of about a month. In more severe cases, it could be up to 2 or 3 months.
More recent literature suggests that infants who go home with the appropriate care and environment and receive the therapy services they need to receive actually in the long run will do just fine.
Dr. Darling says the key is treating the addiction right away. That means babies like this woman's daughter still have a chance at living a normal life.
You can't really tell that she had been on the methadone during pregnancy.
Doctors say the road to recovery for her little girl won't be easy, but it's one that'll be worth it once she's healthy and at home with her family.
It makes me feel good knowing that they grow up just like anybody else and to lead normal, healthy, happy lives.